morning, everyone. It's Jennifer Kravis here, one of the Lyme moms, and I'm here to give you an update from LymeHope on behalf of Sue Faber and myself on the public health sponsored Lyme patient roundtable meeting that was held in Ottawa earlier this week. There is a lot to share, so it'll be a little longer than our usual videos, and I thought I'd give you a different change of scenery rather than my living room. Okay, so who was at the meeting? From Public Health, there was Dr. Sadiqa Mithani, who's the President of Public Health Agency of Canada, as well there was Dr. Teresa Tam, who is the Chief Public Health, Chief Public Health Officer, as well as Dr. Howard New, who is the Deputy Chief Public Health Officer. Dr. Tam and Dr. New are both infectious disease by background. Dr. Mithani is a pharmacist by background. As well, there was Stephen Sternthal from Public Health Agency, who is the head of the Zoonotic Diseases section, and there were also several representatives from the Canadian Institute of Health Research, or CIHR. This is the funding arm that controls how the money gets dispersed, and as well there were several patient advocates representing multiple groups. There were 12 patient groups represented, CanLyme and LymeHope as the two national organizations, and there were 10 representatives representing provincial groups across Canada. So we had excellent representation from virtually every province. So the one thing I want to comment is that this group actually spent quite a bit of time preparing for this meeting, and we had several calls and we've been engaged as a group, and I for one am very, very excited and happy to say that this network of groups across Canada is very united in terms of our priorities, in terms of our desired approach, in terms of where we think things need to go, and we built a great foundation from which to continue a really strong, collaborative, and united force across Canada. It certainly wasn't including everybody that's doing work on the ground, but we had a good cross section, and it was a great opportunity for us to meet in person, and we look forward to continuing that relationship. We collectively, the patient advocate groups collectively prepared a joint opening statement because we wanted to make a strong statement that we are united and that we are working together. And kind of the key message was expressing appreciation for the opportunity, reinforcing how engaged and committed we are, that we do want to build trusted relationships, and also made the point that, to be frank, we all understand there's been a lot of conflict and a lot of very polarized positions, but that really, it's the lives of Canadians at stake, and how important it is for everyone to rise above prior conflict, egos, agendas, hard feelings, and for the sake of Canadians and for the sake of getting things done, it's just so important that everybody rise above this and really look forward and not backwards. So we really hope that this is going to be the beginning of a new dialogue and a new relationship, but we understand that this is not going to happen overnight. We also made the point that it's absolutely critical that there's a crisis. This is happening so fast that it's critical to engage all the resources and expertise that we have on the ground. That means including our Canadian clinicians who are actually in the field treating Lyme patients. It means engaging science groups from all different fields and disciplines, and ensuring that those stakeholders are brought together, not siloed in separate meetings with public health being the messenger, but that we need to have everybody around the table and engaged at the same time. And public health did commit that there would be an opportunity to do that. So we also want to note that in the opening of this meeting, Dr. Mithani, who's the President of Public Health Agency of Canada, she came in and she was holding 3 Lyme letters with us. This was a request that Sue Faber had made to her personally when Dr. Mithani reached out and called her in advance of the meeting. Dr. Mithani actually reached out and called, I think, the majority of the patient advocates who were attending, and Sue Faber had asked her specifically, will you commit to reading some of the letters? And she gave her word to Sue that she did, and she would, and she did. And she came holding 3 letters, and she said that she had been deeply moved by them. 2 of them were written by mothers about their children, and 1 of them was written by a young man talking about what he witnesses his friend going through. She did seem very sincerely touched. She did say that the letters have shown her just how many gaps that there are, and she also said to us, I am here with you. So we took that as a very positive step, and we could not be happier that Dr. Mithani is expressing her desire and her willingness to stay involved. She brings a pharmacological background to the mix, which is a different perspective, and we are very, very excited and looking forward to having her remain engaged on this file. For Sue and I personally, and for all of you who wrote Lyme letters, it was also very validating. Obviously, everyone's fear is that the letters, are going to end up in a box somewhere and no one's going to look at them, but we saw this week that Dr. Mithani had read them, and we think other people are reading them too, and they're so powerful because there's nothing like hearing it directly from the patient voice. This is what gets missed. People talk about policy, but they don't actually hear the suffering and the reality of what's happening. And so we were very, very happy to see that happen. And we also just want to thank again all of you who wrote. It's not easy to share such personal stories and to put your hearts in the line. And so we were very, very happy to see that. Dr. Muthani made it clear that from her perspective, what she wants to focus on is action in the next 6 months. She repeated that twice. She wants to focus on where are the areas where there is consensus, where are the areas that's within their mandate, where are the areas that can be done quickly. She said there has been enough talk and now is time for action. We could not agree more. And so we really, really hope that this is in fact, going to happen, and we hope that we're going to have a real tangible role to play in some of those concrete actions. Okay, so the framework. We obviously have great disappointment about the framework. We do not feel that it properly reflects the patient voice, but what is clear is that amending the framework is not on the table right now. But what public health is saying is that the action plan, which is the rollout of the framework, it's the list of concrete steps and actions that will be taken underneath the pillars of the framework over the next couple of years. That is where we're being invited to engage. Public health is committed to their current priorities of surveillance, education, and awareness. That is where their interest and focus lies, and it's not necessarily aligned with what we think are the critical areas, but within those areas there are opportunities. There's so many opportunities, and so for this, at this point in time, we have to focus on where they're sending an invitation, which is under those categories. And the other point I want to make is that in terms of the patient groups being unified, I want to reassure you, I'm consistently impressed by the strength of the advocate groups across Canada, especially the ones who've been in this for a long time. And the patient groups are working for the patients. We all are consistently acknowledging and pushing and driving home the point that the critical things that need to be done are things that are going to help patients now, that the priority must be to prevent new cases, to make sure that new cases are treated promptly to avoid this illness, chronic illness, and that we need help for patients on the ground now. So even though we're not getting a lot of support for focusing on those areas, we're going to try to find creative ways to attack those areas within the buckets that we're being told are going to be overseeing the next steps. But I do want to reassure you that from the patient advocate group's perspective, this is the priority, that they're helping patients, new patients, existing patients, and future patients, and we're going to continue driving that message. Okay, so what was discussed at the meeting? The meeting was a half day. It wasn't a long time. A lot of it was taken up by public health sharing their updates with us and explaining to us what their process is. And as well, the Canadian Institute for Health Research, that's the funding arm. So this is the body that's going to oversee the $4 million. As well, there's other funding buckets that are accessible. And they spent a lot of time sharing with us what the process is, the timelines, kind of what the criteria are. So this was valuable information. Transparency has been an area where it's been a little disappointing in the past. We were very happy to see that Canadian Health Institute of Research was there to answer questions and to provide some transparency on the process. And that will be the subject of a different update because there's a lot of information. So in terms of what we kind of highlighted, and there was a dynamic group discussion, again, it's our united message that patient-centered solutions are the priority. So some of the things we talked about, we talked about the 2016 ILADS guidelines and how they absolutely need to be made aware and made accessible to physicians, and a message being that these are the best guidelines out there right now, and that the IDSA guidelines, in our opinion, should not be endorsed at this time. They're outdated. They're not based on good science. There's conflict of interest issues. So that is a continuing dialogue. We talked about physician education. So here's an area where there is alignment. Public health is saying they want to do physician education. It's a priority for us as well. But our message was that we need to really move away from the status quo. It can't just be a sheet of paper with, here's a picture of a bullseye rash, and here are the 5 kind of early symptoms, and I see your doctor. That the message really needs to be one that is, there's a crisis happening. We need physician engagement, and how do we give them actual tangible tools that clinicians need to help patients. We talked about the case definition. It's very restrictive, and that there's confusion right now because clinicians go to the website, they click on the case definition, and they think that that's what is required to make a diagnosis of Lyme. And that is not correct. That is a surveillance definition designed to track statistics. It's not what physicians are supposed to be using to make a clinical diagnosis. And we express strongly to public health the need to clarify that and actually even sort of separate them out. There needs to be a separate section for physicians on how do you actually make a clinical diagnosis of a Lyme patient. not looking at the surveillance criteria. They're two different things. We continue to raise the injustice that's being occurred, that workers are being denied workers' compensation, that insurance companies are denying disability benefits. We talked about the urgent need for testing. Obviously, this is a key area. We raised the ELISpot. This is a test which is available in Canada, although not approved right now for Lyme disease. We asked about the Western band not being released. We talked about the need to reach Indigenous populations and how critical it is. They're living in high-risk areas. We talked about the need to engage other federal stakeholders like parks, where people are going in, and what kind of steps are they taking to prevent infection. The need to engage medical organizations as part of the initiative to educate and equip physicians. Those are their bodies. They ultimately decide what messages to send to their own members. We had a lot of question about the funding process. A lot of information was shared around that. That was appreciated. Dr. Matheny specifically asked what's happening in the provinces that can be considered best practices. And I would just like to send a real shout out to Marty LePage and the others in the Manitoba Lyme group who have done a great job of building that relationship with their local public health unit. And they have had some initial success, you know, baby steps, small things, but at least it's a beginning of action, and they have built a solid foundation to work from, and that's fantastic. And I also want to give kudos to the Ontario groups, Linda Kelso from Ontario Lyme Alliance and Ellen Hose from Lyme Ontario. Ontario groups have also had good success with their provincial health units, and there's some learnings to be had. So public health did say that they would try to engage the provincial health units and try to create some dialogue between the provincial advocate groups and the province public health bodies in the provinces, so that there can be a discussion and some sharing of best practices. So I think that will be very helpful. The details are going to be in the provincial arena. So our provincial groups are doing a great job. All the provincial groups are doing a great job, but Ontario and Manitoba, really sort of highlighted how they have approached building that relationship. Dr. Matheny also asked, are there international examples of things we can look to? So again, we emphasize the need for this stakeholder oversight committee. This is a key priority from all the patient groups' perspectives. An oversight committee that is balanced, that includes everybody, IDSA doctors, ILADS doctors, patients, advocates, scientists, medical, clinicians, public health, to get everybody around the table. And it's been legislatively mandated in the United States and France. And this is a key thing that we would like to see in Canada. So we will certainly be continuing to drive that. There's also New York Senate hearings happening, or that were recently happened, and a task force in Pennsylvania. Public health officials seem particularly interested to hear that these committees actually have IDSA and ILADS doctors together talking to each other, because obviously with such polarization, we need to get those groups together and start finding the middle ground, so at least we can start making progress in the things where there is consensus. We talked about the need to capture existing data like vet data, in human cases that do not currently meet the case definition but are possible, probable cases. On the funding, the CIHR funding process, so there was a commitment that there will be a peer review committee developed to oversee the funding grants, and that they said there will be an opportunity for patient representation. Now, we don't know exactly what that means or what is considered a patient, but this is a very important opportunity, and we are definitely going to follow up and get all the details on that and communicate that, so that different patients across Canada, different patient groups who are interested can apply to be on that committee. Okay, so what are the next steps? The next steps are, public health did clearly commit that this is not the first and end. This is not the end all and be all. This meeting is not a one-time thing, that there is going to be a multi-stakeholder, multi-year process where different stakeholders are going to be engaged on an ongoing basis. Dr. Matheny, Dr. Tam, Dr. New all sort of agreed that. They said they're going to get back to us with kind of a roadmap or some future dates and some information on exactly how that's going to go forward. Okay, so in summary, next steps. So public health committed to reaching out to the provincial public health units and facilitating a discussion with patient advocate groups. They committed that there will be more meetings and that medical and science will be included and not siloed, and they said that they would get back to us with a roadmap and some dates. They did say that they would look at the website. That was one area that we asked for. So I think that was it. So we are going to follow up with recommendations jointly from all the advocate groups. So how do we feel? So on behalf of LymeHope, I can say that we are thrilled at the collaboration of the national advocate groups across Canada, and would like to really recognize and acknowledge the contribution that they've made in the work that they're doing on the ground. We're very happy to hear that Dr. Matheny is going to stay involved and expressed desire to see action. We were happy that there was some sharing of the funding process, which we can disseminate in a later update. And we're cautiously hopeful that this is going to the beginning of an ongoing relationship. It's not going to move quickly. So we'll continue to do everything we can to continue pushing the issues and raising awareness among other stakeholders like MPs and people in the government. We will follow up, and we will hold them accountable to continue to report and deliver on the commitments that we made. We were very, very pleased to participate, and we really sincerely hope that we can develop some trust and repair some of the conflicts so that we can actually develop a functional working relationship. And the last thing I would just like to note is I would like to specifically acknowledge Dr. Ted Cormode, who represented the Victoria Support Group. He's a retired pediatrician. His daughter has Lyme disease. He has spent hours and hours of work and research. He should be enjoying his retirement, and in fact, he dedicates so much time to this issue and is really a credible voice. And I really hope that other physicians will be inspired by him and take things up, because he deserves a break, and we just want to specifically thank him for stepping into this arena. So that's it for now. Stay tuned, and thank you again for your support.